The PhysioPilot is a portable, joint kinematic device for clinicians. Here is the PhysioPilot's compact case with handle and wheels. Inside the first layer, you'll find the camera on the left, the laptop on the right, trackers in the middle, as well as plates used to attach the trackers, and the pointer for landmark registration. The bottom layer is for all connection cables. It's worth mentioning that both camera and laptop have individual batteries. Finally, the deepest layer receives the tripod and the elastic straps. The camera is easily assembled on the tripod, and the laptop is placed on a small table 2 meters away from the examination table. Here is the first screen where clinicians write their names, departments, the patient's names, date of birth, gender, and operated side. The next screen records the camera's position with respect to the patient's leg. Here, it is the contralateral. The patient is in supine with the 2 bare limbs. The first strap is circled around the thigh a few centimeters above the patella, with the plate facing the VMO tendon. The second strap is placed a few centimeters below the tibial tuberosity, with the plate facing the medial tibial surface. The first red tracker is attached to the femoral plate, the blue tracker to the tibial plate, and the yellow tracker is affixed on the pointer's assembly. The registration starts with the landmarks registration through an automatic recording of the medial epicondyle, the lateral epicondyle, and the middle of the knee. Then the surgeon registers the medial malleolus, the lateral malleolus, and finally the middle of the ankle, concluding the landmark registration. Next is the kinematic registration, starting with the center of the hip recording an L-shaped movement, and finally, the knee kinematic center is recorded through flexion and extension, and also external and internal rotation of the knee. The registration is now complete. The screen displays in real time each movement of the knee in varus valgus on the vertical axis and in flexion extension on the horizontal axis. The yellow dots are recorded during flexion, and the blue dots are recorded in extension, drawing the natural knee laxity envelope. The knee can then be stressed in valgus and varus close to 0 degree, 15 degrees, and 30 degrees, demonstrating the limit of knee laxity in these ranges. The Lachman test can also be performed, assessing the state of the anterior cruciate ligament. It is also possible to assess the isokinetic dynamic knee flexion, so important for sport doctors and sport scientists. In addition to monopodal and bipodal alignments, it is possible to evaluate the dynamic knee valgus.